Hi, welcome back to Daily Detoxification. I'm here with Dr. Alexander Haskell, who is an ND, has been in practice for over 20 years, and has come to the realization that most of his clients benefit from detoxification, hence this program. So the topic today is heavy metals. Tell us a little bit about what you've come to in your experience in your practice.
Yes, well, probably everybody's heard the term heavy metals, and it's associated with, harmful effects upon various parts of the body, especially the neurological system and of course, the brain. So I think it's just important to increase people's awareness of the, not only the harmful effects or downstream effects from these heavy metals, but also to know about how we need to protect ourselves from these and also how to avoid them. Getting rid of them from the body is a little difficult sometimes and requires some medical supervision, but there are some products in the market that are relatively effective. But
Great. So what would you say is, what would have somebody care about? What would be the symptoms, what would be the effects, what would be the effects on their vitality, the effects on their health, what would be symptoms of somebody that's dealing with heavy metal toxification?
Yeah, it's sometimes kind of difficult to differentiate. Let's say if a person has a neurological issue or let's say issues with concentration or, in older ages maybe becoming senile, because it can be, nutritional deficiencies. It can be also exposure to other chemicals in the system. So for a person to sort of be evaluated, it requires, there's certain tests primarily using, you can use blood for testing if it's a present exposure, but usually it's a insidious, taking time to build up in the system, and then you've got to use other testing using urine after some kind of provocation, some type of what's called a chelator, which grabs onto heavy metals and pulls them out of the body primarily through the urine. You can do that provocation and test the urine and see what metals are coming out. So it is challenging to kind of delineate or determine if the issue is due to heavy metals, but we're so full of other chemicals from our environment that it's probably a complex of different issues going on that's causing something to do with the nervous system, like Parkinson's or dementia or things like that. So it is challenging. But I think the important part here is just to make people aware that it is a possibility and how to avoid them.
Yeah, and I would imagine that things like Alzheimer's or Parkinson's are things that are extreme cases of, down the line. So this is preventative, and this is really getting people back to their vitality. So if I'm just somebody that I don't have illness, but I'm not feeling totally 100% in my vitality, would it be like brain fog? What would be the symptoms of just mild case of someone that, I would imagine almost every single human being has some kind of heavy metals going on. What are the first little symptoms that you wouldn't really even realize are symptoms?
Well, in terms of, in the clinic we do that provocation. We use an intravenous solution called EDTA and also DMPS, and if I suspect there's an issue or they're having, neurological issues or numbness and tingling or brain issues, then a lot of times people want to know. So we do the IV, they collect urine, we get a report back from a lab in Chicago, and we look at the profile of what metals have come out, and then that determines if we go in that direction or if it may be something else that's affecting their health. So, yeah, it's difficult for people to know, is my condition due to heavy metals or likely a combination of different things. So we look for past exposure, especially like heavy metals or the mercury used in dental amalgams is one thing. If a person's had a lot of amalgams or still has, or they had them in the past, they had them removed and replaced with a white composite, it can be an issue. You've got to work on different directions in trying to clear toxins out of the body. Heavy metals is one of those areas to focus on with a lot of people.
And so where does it come from? Obviously, I would imagine majority of people know that the metal fillings in their teeth aren't good. What other areas of life are heavy metals coming into people's, is it through the soup cans? Where is it coming from? What sources?
Yeah, any exposure to any metals is going to, cause an exposure to an ingestion or breathing in these metals. So a lot of people don't realize that, in the category of heavy metals, there's lots of them. And of course, there's lead and tin, and also even arsenic, and many of those, probably I think around 10 different substances that are considered to be heavy metals. So those are, they're all in studies. I think the most important area to focus on, though, is to help people realize about metals in their mouth with these amalgams. And of course, if people become more educated, they won't necessarily take the advice of the dentist that says there's no problem with these silver filling, what they call silver fillings, and they'll be informed. And so I think maybe I'd just like to say a few things about that.
Okay, great.
Yeah. So people don't realize that the reason why mercury is used in a dental amalgam is because it's the only metal that is a liquid at room temperature, so that the mixing of other metals, commonly silver and tin, I believe, is the other common alloy or other ingredient in these amalgams, are mixed with mercury, because mercury makes it those mixes of metals very pliable, easy to get into the tooth. So the issue is that everything that's a liquid, so things are either a solid, liquid, or a vapor or gas. So because mercury is already in a liquid state in the dental filling, any kind of friction or something that would heat up that filling is going to cause more of the mercury vapors. Some studies show that the ingestion of mercury from fillings is not the issue, because there's apparently certain protective layers in the gut that does not allow mercury to come through. But many people's guts are compromised with what's called leaky gut syndrome. But the primary issue is breathing in the mercury vapors from these fillings. So when a person is chewing gum, or if they're eating, drinking hot liquids, or even chewing food, it causes a heating up of that amalgam, and the vapor starts coming off, and some of it's swallowed with the food, but some of it's also breathed into the lungs. There was one seminar I went to where this dentist who had recovered his health from all the exposure to mercury, he installed a machine that would measure the amount of mercury vapors in their dental office, and wow. As soon as it reached a certain level, he had a special ventilation system installed, so he'd turn that on and clear the mercury vapors out of the office. So he brought that instrument, just maybe a foot long, and asked if there was anybody in the audience that still had fillings, or 3 people that volunteered to come forward. He measured by putting a straw on the intake valve on the unit. He put with the machine on, put the straw into the person's mouth. It sucked air from their mouth, and I think the highest reading that he got from those 3 was like 8 parts per million of mercury vapors. It gave them each a stick of chewing gum. They went down back to their chair, chewed gum for 10-15 minutes. They all came forward. He measured them again. The lowest was, I think, around 10, and the highest was 80 micrograms per liter, or whatever it's called. I can't remember the units. So the person jumped all the way up to 80 after chewing gum for 10-15 minutes. That means the mercury's vaporizing out of these fillings. So he said, that's unusual to go to 80, but I suspect that you have a mix of different metals in your mouth, probably gold in one filling and probably the silver mercury amalgam in another, which he did. So it's a great exhibition or example of how mercury is vaporized just from getting an amalgam heated up.
Mm-hmm. So that leads me to a few questions. One is, let's pretend somebody has mercury fillings and they can swap them out to, it's ceramic, is that what it's considered, the white fillings?
Yeah, it's called a composite, yeah.
Okay, so how would they deal with either, getting rid of the, if they can't go to a doctor and they just want to purify through natural ways, through fasting, through sauna, through whatever, what can they do to get rid of this heavy metal in their body?
So there's a few natural approaches which would help to remove mercury from the tissues. Primarily, there's 3 that I use. One is cilantro. It's an herb. Chlorella is another one, which is from the ocean. And the third is called N-acetylcysteine, or also known as NAC. and those are also known to bind onto heavy metals and take them out of the body. It takes a lot longer to do it that way. And then you've also got to support the system with using some, antioxidants, because as these metals are pulled out, it does cause some stress on the system. The immune system can be a little bit weaker during that time of pulling metals out. And something as simple as like a natural form of vitamin E, and also, if possible, a natural form of vitamin C. So some companies do make their supplements from foods rather than synthetics, and I really prefer bringing nutrients into the body in a food form rather than a synthetic form.
Okay, great. So we've got those three, cilantro, chlorella, and what was the third one called again?
It was called MAC.
MAC. And so where would somebody find something like that? Where could they just go on the web, or can they go down to their local health food store? Where would you find something?
Yeah. These days, you can find most everything at natural food stores. The limited selection that the web has, just about everything a person would need. Hundreds of different manufacturers of different products, rather than maybe 20 or 30 you're going to find in natural food stores, just because of shelf space.
Okay, great.
They're all yeah.
And then if they do want to go into a doctor, they can do. What are the different names of those one more time for everyone?
Yeah, so you'll have to do a Google for chelation therapy. That's CHELATION, chelation therapy. And it's performed by both medical doctors and naturopathic physicians. Anyone that says they're doing chelation should have been through the proper training on how to do that. And then they can go into them and speak to them about the evaluation and what chelating agents they're using for the provocation. And the two agents would be one called EDTA, which is focuses primarily, these chelators have an affinity for heavy metals, and the strongest affinity that EDT has is towards lead, first of all, and then it will, once the lead starts declining, then it will start taking out mercury, and sometimes arsenic will be the second or the third of the heavy metals they'll start to chelate out. The DMPS is used primarily for mercury, but it will also pull lead. And we do a combination of both the EDTA and lead in the same IV, which some docs are doing it that way. Some others do it just EDTA only, and then maybe some DMPS is kind of alternating back and forth.
Okay, great. And so what other areas, just so we educate people really on the topic today being heavy metals, what other sources are there? Obviously lead paint, so if there's a child that's, eating the lead paint or something like that, we know we've all seen those disclosures and things now. What other areas what about the cans that we get our soup in? Is there better cans than others, or are they all fine, or tell us about other sources of heavy metals?
Yeah, I would think that most cans are probably lined these days, so there's no more tin exposure for people. Just, things start changing when containers are heated up. If a can sits in the sun and, 100 degrees, that's a really hot transportation from one place to the next. You're going to probably have some heavy metals leaching out of those. But, of course, lead in pipes in older homes. You've got other issues with plastic plumbing these days, with PVC and various things like that. Also, a lot of the pesticides and herbicides do contain arsenic. So it's really insidious. It's hard to really, look at all the different sources of heavy metals, but they're around us. And there was one lady that just kind of a quick story. She had, not myasthenia gravis, but multiple sclerosis. And so she had these symptoms all over her whole body of weakness and neurological issues. And I said, you've got to go to a holistic dentist and have this taken care of. And when you go to the dentist and they remove or replace mercury amalgams, they work on one side of the jaw to start with. So she had upper and lower done on her left side, and she called me like 4 days later. She says, I don't believe it, that all my symptoms on the one side of my body are beginning to clear. And within like 2 weeks, her whole, I believe it was her left side of her body, was completely clear of symptoms, and it wasn't until she had the other amalgams removed from the opposite side, and it was right side, and then within a month she was completely clear of all of her symptoms. And I've never seen that happen before with anybody, but a lot of people whose health improved after the amalgams were replaced. And of course, if you're working with a holistic dentist, there's a protocol of what to do ahead of time and what to do the day of the amalgam replacement, and then what to do for like 3 or 4 or 5 days later, because there is some exposure during that procedure, no matter how careful the holistic dentist may be.
Fantastic story. One thing that just came to mind is, I heat my water up for tea and such in this kind of, it's a metal, automatic thing that you can press down that heats all the water up. So what if people are heating water up in pans or whatever, what are the good types of pans versus bad types of pans for metals?
Yeah, I'm really cautious about any metal that's being heated. So if I'm heating water up for making tea or coffee, then I will usually use glass instead of anything metal. Mm-hmm. And I think people have to be really cautious about these pots that have coils inside of them. I know yours, it's a safe one, but people with these coils inside of the water, little heaters, I'd be very cautious. Mm-hmm. Doctors Data, it's a lab in Chicago. They will, if you just call them, they will send you a water test kit, and you can test your tap water if you are drinking tap water, which I don't really recommend. But any water in the house, even the water that you've been using for heating your water for teas and things, you can send them a sample of water. They'll give you a complete profile of all the heavy metals that are found in that water.
It's crazy to just think about. It's almost like this work is so important, and become conscious of it, because our vitality and our mental state every day is the difference of us being productive or even just enjoying the day, and really appreciate all the information. And I'm sure, the lucky thing for all of us out there is that there is a thing called, Google, and we can get on and educate ourselves more. And so we try and take each topic and touch on an overview of everything, but there's more always, and you may have, specific questions or whatever, and we're here for you. But there's also Google. You can type in things and find out, educate yourself on these things. Metals really can be heartbreaking to watch somebody really get a metal toxins in their brain and begin to really deteriorate. And so better to catch it way ahead of time. Preventative is always better. And anything else before we head out?
I think only, I remember reading a book about 20 years ago, and I don't remember the name of it, but there was a gentleman who wrote it who had sort of gone through the chronological history of developing what the doctors termed Alzheimer's, and for some reason he was so motivated to deal with heavy metals, and that's what he focused on completely. He had all his amalgams taken out, went through chelation, and ate the right kind of foods, and really watched his exposure to heavy metals, and he came out of it, which was remarkable. It takes a tremendous will to do that, but he came out and he recovered his mental health just by focusing on nutrition and probably some lifestyle, and also getting heavy metals out of the system. Yeah.
Fascinating. Thank you. Great topic, really important, something that a lot of people never even have ever heard, that metal fillings are this bad for them. They have no idea. Others are highly educated in it, so it's a topic that needs to be touched on. So appreciate it, and thanks you guys, and have a beautiful day. Ciao.